Assalamu alaikum. Yes, part 2 of your pharmacology and toxicology. Alhamdulillah, yesterday we have uploaded part 1 of the pharmacology and toxicology. Now this one is the part 2 of your important questions and answers of D pharmacy second year pharmacology and toxicology. Let's discuss with question number 13. See question number 13, what it says. First question, define hypertension. See, in this hypertension, my dear brothers and sisters, they are given classify antihypertensive drugs with example. Very simple. First, you write what is this hypertension? A condition in which the force of the blood against the artery wall is too high. Okay, usually hypertension has the blood pressure above 140/90 and considered severe if the pressure is 180/120. Means, see, this is the blood vessel. Okay, now what happens inside your blood vessel, the penetration or the bonding between this blood vessel and the blood increases. Means just see, these are the blood cells. What they will do, they increase the penetrations here. See, for like this way, they increase their penetration fast, quickly they will hit to this arterial wall. Now what happens, due to the hitting of this RBC so quickly for this arterial wall or rashly to this arterial wall, your blood pressure increases. Simple. Against the artery walls is too high. Very simple. Now classification of this hypertensive drug, some of the classifications are there. Let's discuss those classification. Four main classification of this antihypertensive drugs. The four major consist of antihypertensive drugs are diuretics. These are used in the treatment of high BP. Yes, these helps your kidneys release more sodium into your urine. Examples, furosemide. See what happens automatically if your urine passes more sodium content electrolytes, means then what happens, gradually your BP lows down or comes down. Then beta blockers, these are used to reduce risk of high blood pressure. Labetalol, carvedilol. Example, calcium channel blockers like amlodipine and nifedipine. Then renin angiotensin system inhibitors, example ramipril, then trandolopril and lisinopril. These all are the example. Okay, and some questions, not some questions, 5% questions from pharmaceutical chemistry 2 you will get here. 5% questions from pharmaceutical chemistry 2. Those questions will again repeated here. Some questions what I have done, my dear brothers and sisters, I have not repeated here. Okay, I have not repeated here. You go and download the pharmaceutical chemistry 2 notes. There you will get some questions. Means this pharmaceutical chemistry 2, pharmacology and toxicology, these are interrelated to each other. And also hospital pharmacy, some questions also interrelate here. Okay, so if you are second year D pharmacy, means you are having the great opportunity to pass the examination, because all the subjects here are relating to each other, having good relationship. Now classify antacids with examples. See, antacid is a substance which neutralizes stomach acidity and is used to relieve heartburn, indigestion or on the upset of the stomach. Simple, like Gelusil you are using in the home, Digene syrup. Classification, systemic antacid, these are absorbable. Means these antacids, what they will do, these chemicals they will absorb in the intestine. Example, sodium bicarbonate, that we call as ENO. Non-systemic antacid, they are non-absorbable. Aluminum containing antacid, aluminum hydroxide. Calcium containing antacids, calcium carbonate, then tribasic calcium carbonate. Magnesium containing antacids, magnesium hydroxide, magnesium carbonate. Combination antacid preparation, nowadays this type of antacids are preparing in the industries, like aluminum hydroxide gel and magnesium hydroxide, simethicone, dimethicone. These all are the antacids what you are observing in the market. Gelusil, Digene, Pandy, these all suspensions, these are known as antacids. Now let's move towards the 14th question. Write the uses for each of the following: metronidazole, INH, ranitidine and digoxin. See, this metronidazole you will observe where? In the pharmaceutical chemistry 2. Metronidazole, these are the drugs used to treat infections of the reproductive system, gastrointestinal tract, skin, heart and other areas of the body. Mainly it is an antibiotic. Then INH, isoniazid, is an antibiotic used to treat the tuberculosis patient. Then ranitidine, the drug which is used to treat hyperacidity. Ranitidine. Digoxin, it is used to treat various heart condition, mainly used to treat irregular heartbeats. Digoxin, okay, mainly it is used to treat the BP, heart, to decrease the heart rate or heart rhythmic property. Okay, simply these are diuretics. Classify anti-cancer drugs. Anti-cancer, see, the drug is effectively used in the treatment of malignant or cancerous disease. Okay, these are several major classes of anti-cancer drugs. Many are there. A classification of anti-cancer drug like alkylating agents, alkyl sulfonates, example platinum coordination, cisplatin and carboplatin. Then microtubule damaging agents like vinccritin and docetaxel. Then antibiotics A, actimycin D and mitomycin C. Miscellaneous, some of the examples like hydroxyurea, L-asparginase and tretinoin. These are the some examples. Okay, these are the anti-cancer. This question also repeated in pharmaceutical chemistry too. Here also again it repeats. Yes, now let's move towards the question number 16. See, in question number 16 what they ask, very important question. Don't skip the video, watch the one until last, because this 20 to 25 minutes video really it will give you good marks. Without missing this, without skipping this, you have to observe the video. Okay, very important questions and answers I had covered here, my dear brothers and sisters. Next subject for you is jurisprudence, pharmaceutical jurisprudence. Be ready for that. Laxatives, any drug used in the treatment of constipation to promote the evacuation of a feces. Okay, to promote the evacuation of a feces or FECES, FECES, feces. It's very simple. And these produce their effect by several mechanisms. Okay, many mechanisms are there. Classification: bulk forming, dietary fiber, isabgol, stool softener, liquid paraffin, example. Stimulant purgatives like bisacodyl, sodium picosulfate, castor oil, senna. Osmotic purgatives: magnesium sulfate, magnesium hydroxide, sodium sulfate, lactulose. These all are the classification of the laxatives. Now let's go towards the 17th one. Define antibiotics. Classify semi-synthetic penicillins with example. Explain the pharmacology of streptomycin. Streptomycin, it is an antibiotic. See, antibiotic, these are chemical substances produced by various species of microorganisms such as bacteria and fungi, which in low concentration destroy, kill or inhibit the growth of the other species of microorganisms. These are known as antibiotics. Opposite to simple, antibiotic means they are used to kill or to inhibit the action of the bacteria or fungi. Simple. Now let's discuss about some of the example penicillin and streptomycin. Classification of a semi-synthetic penicillins. Classification. See, this is the semi-synthetic penicillins: acid resistance, penicillinase resistant penicillin, then extend spectrum penicillin. Example for the acid resistance is phenoxymethyl penicillin. Example for penicillinase resistance is methicillin and cloxacillin. Then here example for extended spectrum penicillin is amoxicillin and ampicillin. These all are the broad spectrum antibiotics. Okay, now pharmacology of the streptomycin is very simple. Streptomycin was isolated from the strain of Streptomyces gyrus. Mechanism of action: irreversibly inhibits bacterial protein synthesis. Protein synthesis is inhibited in at least 3 ways. Here we will discuss here 3 ways of inhibition of the protein. Basic thing of this streptomycin antibiotics is they will directly attack to the ribosomes, they will directly attack to the protein of that particular bacteria or fungi. See, interference with the initiation complex of peptide formation. You know that initiation complex, first complex, okay, they will just attack to the initial complex of the protein. Okay, then misleading of mRNA. After attacking this for the protein, what happens? Their formation of the mRNA strand get misleads, which causes incorporation of incorrect amino acids into the peptide, resulting in a non-functionating or toxic protein. Breakup of polysomes into non-functional monosomes. Simple. Okay, then streptomycin used in the treatment of tuberculosis, plague, rat bite fever and brucellosis. Brucellosis. Very simple. Brucellosis. You remember plague, tuberculosis, rat bite fever. Yes, these are the mechanism of action of the streptomycin. Then define a narcotic, analgesic, classify them with example, explain the pharmacology of morphine. See, sometimes what they will give, by giving narcotic, they will give opioid. Okay, what is opioid analgesic? Same you have to write narcotic, analgesic. These are the chemical substances primarily used for the pain relief, including anesthesia. They are also used to suppressing cough. Sometimes to suppress the cough we are giving this, like codex, codeine phosphate. Okay, classification: morphine widely used for the acute and chronic pain. Then methadone used for the chronic pain, maintenance of addicts. Then pethidine, acute pain. Okay, pethidine, acute pain. Then pentozocine, mainly used for the, this is also used for acute pain. Yes, now let's discuss about the mechanism of the action or pharmacology of this morphine, opioid or morphine narcotic analgesic. See, morphine and other opioids act on the opioid receptor units. Okay, they will act here and they will produce a mu and a kappa or and delta. Mu and kappa and delta. They decrease the CAMP, that is one site present on the neurons. They will decrease here CAMP, changes in gene expression that decrease the calcium influx, which decrease a neurotransmitter. Decreased neurotransmitter release automatically decrease pain. Simple, you remember morphine, what they will do, they will act where on the opioid receptors, like this one, mu and kappa, acts on opioid receptor units, mu and kappa. These are the two units. These units, the what they will do, they will decrease this CAMP. You know that it is the ATP molecules, mainly cofactors, these all are. And due to the decrease in the CAMP, what happens, there is no chance of oxygen production, so gene get changes, so that what happens, there will be decrease in the calcium influx, that leads to the decrease in the neurotransmitter functioning. Neurons are main no to cause the pain, because they only send the signals to the brain. For an example, see, I will give you one example here, beautiful example. See, now this is the hot pan. What is this? It is the hot pan. Okay, now if you touch this hot pan, means what happens, your this palm, it senses and send the signals from here to the brain. That brain again sends the response. Okay, then only you will lift your hand. Until that you can't, you are unable to lift the hand. Now here what happens, these analgesics like morphine, what they will do, they will stop the action of the neurons here. By stopping the action of the neurons, you are unable to sense the feelings, sense the pain, unable. Why? Because of the loss of sensitivity, loss of neural signals, decrease the pain. Analgesics, simple one, mechanism of action of morphine. Now let's discuss the question number 19. What are oral hypoglycemic? Classify them with example. Explain the pharmacology of metformin. See, oral hypoglycemic drugs used in diabetes mellitus by altering the glucose level in the body. Simple. Exceptions of insulin. Here, exceptions of insulin, most GLP agonist and most we are using the GLP agonist and pramlintide, all are administered orally and thus called oral hypoglycemic agents or anti-hyperglycemic agents. Generally these are hypoglycemic agents. If your blood glucose level rises for 200, 250, 300, then what we are supplying, we are giving this a hypoglycemic agent or oral anti-hyperglycemic agent. To treat the hyper, we are giving anti-hyperglycemic agents. Classification: sulfonylureas, first generation, like tolbutamide, then chlorpromide, acetohexamide, then second generation glibenclamide, glipizide, glimepiride, then bugonides like metformin, okay, fenformin, then meglitinide analogs like ripaglanide and netiglanide. These are the some example. Let's discuss with see, one more is there, thiazolidinediones. Very complicated words here. See, next example is pioglitazone. Next one, alpha glucosidase inhibitors, acarbose and biglitol. Pharmacology of metformin, very simple. This is the metformin tablet. What they will do, they will enter into the mitochondria. Okay, mitochondria, they will form complex 1 and MGPD. It is the hepatic enzyme inhibition. Now this converts NAD into NADH plus, relates to AMP. You know that it is the coenzyme. Okay, and FAD into FADH. That process is known as gluconeogenesis. Now these what they will do, they will convert AMPK and AMP glucose metabolism, lipid metabolism, redox regulation, anti-inflammation, glucose metabolism and lipid metabolism. These all processes have been completed here. Simple, what they are doing means they are they are stopping the production of glucose level. These metformin, what they will do, they will stop the production of the glucose level in the human body. By stopping stop the conversion of the glucose level in the body, what happens, automatically your glucose level get decreases, it comes to normal. Main function of this metformin, mainly this will act on the liver. Okay, mainly they will act on the liver only, my dear brothers and sisters. Yes, and let's discuss on the question number 20. Define Parkinsonism, name the drugs used, write the pharmacological action, adverse effects and the dose of levodopa. Parkinsonism, a progressive disease of the nervous system marked by tremor, muscular rigidity and slow imprecise movement, is known as Parkinsonism. Very simple, what here, the tremor, always shaking in this way, always shaking of the palm, shaking of the hands, right leg, left leg, limbs, forelimbs, hind limbs, what happens, movement. Why? Because of the improper neural activity. It is mainly affected in middle-aged and elderly people. It is associated with the degeneration of the basal ganglia of the brain and the deficiency of the neurotransmitter dopamine. Due to the absence of this dopamine neurotransmitter, okay, what happens, there will be this type of characteristics has been formed, like slow imprecise muscular movement, improper movement, tremor. And here underlinings, you have also do this underlinings, because this will give you grace marks here. Grace marks means good marks. Causes, mainly genetic and environmental causes. Symptoms like stiff muscles, difficulty in standing, difficulty in walking, restless sleep, easy early awakening, means they are unable to sleep at night. Example, drugs used for Parkinsonism or Parkinson disease is levodopa and carbidopa. Dopamine agonist, these drugs act like dopamine in the brain. In the brain, what they will do, these drugs act like a dopamine. For an example, like rotigotine and pramipixole. Actually, dopamine, function of the dopamine, it is a neurotransmitter. It will give you always, while you are laughing, okay, if you feel a goodness for your body, if you feel a happiness, means why that happiness, because of this dopamine. Okay, always see this depressed patient or this central nervous system disorder patient, they are not happy at all. Why? Because of this dopamine improper secretion. They are always dull, they are always depressed, for this reason only. Then the next one is amantadine, entacapone and tolcapone. Then pharmacology action of the levodopa. Levodopa is a class of medication called a central nervous system agent. It works by being converted to dopamine in the brain. What it will do? By being converted to dopamine, this levodopa get converted as a dopamine in the blood. It will take substitute of the dopamine. Which one? This is levodopa. Carbidopa is in the class of medication called decarboxylase inhibitors. It works by preventing levodopa from being broken down before it reaches the brain. See, actually what happens, this levodopa and carbidopa, both we are giving in one combination, means both levodopa and plus carbidopa. Why? Because means levodopa, they act as a dopamine, and here carbidopa, what they will do, they will make, means they will stop the wastage of this levodopa before reaching it off to the brain. Okay, sometimes what happens, levodopa get breakdown and it enables to reach to the brain. Okay, this process inhibited by the carbidopa, means they will act as supporting for this levodopa to reaches to the brain. Simple, you remember this one. This is the pharmacological action. Then adverse effect is dizziness, loss of appetite, diarrhea, dry mouth, mouth and throat pain, constipation, change in sense of taste, confusion, forgetfulness. Then doses, the starting dose is 1 tablet 3 or 4 times a day. See, the dose usually not more than 200 mg per day, mg. For patients taking carbidopa and levodopa, already 25 mg per day of levodopa. Means already those who are taking this levodopa for 5 months, for already they have taken for 1 year, 6 months, for them only 25 mg. Initial patient, now they are taking for them 200 mg per day. Yes, these are the very important questions. Let's discuss some more questions. Question number 21, explain the different types of insulin preparation. Insulin preparation, thus these are chemical preparation used to treat hyperglucose level or to give substitute of insulin in the body, different types of insulin preparations are. For an example, see ultra short acting insulins, they are very fast onset and short duration. Lispro, okay, these are the insulins. You might have observed that your grandma or grandfather, they are using the human mustard insulin. These human mustard, these all are the insulins only. Okay, they are classified on their action, means for what duration they will act, for what time they will act. Short acting insulins, regular insulins like insulin R, human insulin R, these are a fast onset and short duration, means the duration of this is the only short, like half an hour, they will work for only 1 hour, like this way. Intermediate acting insulin, these slow onset and relative long duration, 1 to 3 hours, like insulin aspart and glutathione. Then long acting, a short onset is very short and they will act for the long, like 4 hours, 12 hours, 6 hours, like for an example Lantus you are observing, glargine, Lantus. Yes sir. Now some repeated questions I have collected for you. I will tell you some of the repeated questions here. Yes, this one, organophosphorus poisoning. See, organophosphorus poisoning, simple, these are the poisoning due to the organophosphates. They are used as an insecticide, medications and nervous agent. These questions are repeated where? It get repeated in the pharmaceutical chemistry 2. These organophosphate poisons are the group of potent nerve agent functioning by inhibiting the enzyme called estradiol. Causes, main cause is due to the suicide attempt. Exposure can be from drinking, breathing and vapors or skin exposure. Symptoms, salivation, lacrimation, urination, defecation, then gastric cramps, nausea, vomiting, diarrhea. Treatment, check airway breathing properly. Then you have to give anti-activated charcoal 50 gram in 200 ml water. Okay, these all are the simple treatment for this. Next one is yes, these all are the very very important questions, my dear brothers and sisters. One more very important question, this one. Classify anti-malarials with example. The drugs are a type, means these are the type of anti-parasitic agents that can be used to treat or prevent the malaria. The malaria mainly targets the young children and pregnant women. Classification, antibiotics, then sequestrapine, lactones, amino alcohols, naphthoquone, then 4-amino quinolines, then cinchonoalkaloid. See, these all are the some of the example here. Yes sir. Now see, these are the pharmacology of the chloroquine. Chloroquine, it is also one drug which is used here. Which one? Chloroquine. Yes, see, these are the classification of antimicrobial drugs with example. Write the pharmacokinetics, pharmacodynamics, adverse effect of the chloroquine. See, the drugs which are used to prevent the malaria, we already discussed now. Pharmacology and of chloroquine is, you know that chloroquine, what is this? It is the antimicrobial agent or the drug. The drug chloroquine is bactericidal, means they will stop the growth of the bacteria, they will kill them. For Bacillus megaterium, it inhibits DNA and RNA biosynthesis and produces the rapid degradation of the ribosome and dissimilation of the ribosomal RNA. It also gradually inhibits the protein synthesis. Simple. This is the pharmacology of this one. Now let's discuss with the write a note on oral contraceptives. Oral contraceptives are the pills taken by mouth to prevent the pregnancy. Most oral contraceptives include estrogen and progesterone. They are also known as the birth control pill. Classification, combined hormonal contraceptives like estrogen plus progestin, then monophasic, biphasic and triphasic, then progestin only contraceptive, mini pills. Then pharmacology of oral contraceptive. See, for the combined oral contraceptive and the progestin only methods, the main mechanism of action are the inhibition of the follicular development, ovulation and corpus luteum formation. Mainly what these pills they will do, they will stop the follicular development, they will inhibit here, and they will inhibit the ovulation and corpus luteum formation. By this way automatically the woman can't be pregnant. It also inhibits the sperm penetration. Yeah, yes. Now the next one is a malarial parasite, life cycle of the malarial parasite. Very simple, life cycle of the malarial parasite. See, after the enter of this malarial, means the liquid of the malaria enters into the human body, what it will do? Sporozoids injected by the mosquito, first point. Then exoerythrocytic synzogony in liver. What happens? These will convert into this exoerythrocytic syngogony in the liver. This is second step. Then third one, erythrocytic syngogony in the red blood cell. This erythrocytic cells, where erythrocytic syngogony, it again transferred to the red blood cell. Mainly what happens, your RBC major production takes place in the liver only. Liver, bone marrow. Liver is also a major production of the RBC. Then gametocytes take up by the mosquito gradually. Then sporogony and sporozyte production in mosquito. After that, what happens, these will start their division, multiplication. Spores has been formed in your red blood cell. Okay, that circulated all your body, and means interaction between this white blood cell and your this one mosquito liquid. Mosquito liquid means this sporogony cells, sporozoite cells. Then what happens, these will give you fever, headache, mainly fever, high fever, chill fever. Yes, my dear brothers and sisters, these are the very very important questions of your pharmacology and toxicology too. Now inshallah we have completed part 1 and part 2. Soon I will upload our subject pharmaceutical jurisprudence. If you are new to this channel, subscribe my channel Let's Join Pharmacy and turn all the bell notification. Thank you. Assalamu alaikum.